Senator Bennet.
Thank you, Mr. Chairman, and I'll be brief. I know you're anxious to vote. I want to say at the outset I'm very glad that the Finance Committee is working to make reasonable improvements to the Affordable Care Act, and I hope that this is the beginning of a depolitization of the discussion around health care. Today I've filed several amendments to address our veterans' health care, particularly in Colorado, and although they may be outside the scope of this markup, I hope that Congress will be able to consider them in the coming months. Two of my amendments would speed the completion of a new VA hospital in Denver, Colorado, which is long overdue. The first amendment is based on companion bills introduced today with Senator Cory Gardner in the Senate and led by Representative Mike Kaufman in the House. It would enable the Army Corps of Engineers to take over the management of the project so that we can complete the hospital as quickly as possible to serve our veterans. The second amendment would provide the VA greater flexibility to provide additional resources to the project. Both of these amendments will help correct, I hope, some of the VA's considerable mistakes and ensure that veterans throughout Colorado and the Rocky Mountain West can receive the care they deserve. I've also introduced two more amendments that make needed improvements on the recently created Veterans Choice Program. First, under the current program, a veteran who lives more than 40 miles away from a VA medical facility can use a local private doctor to meet their health care needs, which I've heard a lot of veterans in Colorado say they would like. But unfortunately, the law that we passed measures 40 miles in a straight line. And given the mountainous terrain of rural Colorado, this is completely impractical. My amendment would ensure that the VA measures 40 miles to reflect the actual distance that a veteran has to travel rather than as a straight line. In other words, the way a real American would measure a distance, not the way we're doing it here in Washington. This would provide greater health care choices to veterans throughout Colorado. Second, we have veterans disqualified from using the Veterans Choice Program because they live within 40 miles of a qualified VA medical facility, even when that facility does not offer the care they need. For example, if they live 40 miles away from a VA outpatient clinic, but you need inpatient hospital care, you don't qualify for the Veterans Choice Program. This amendment would change the law so that veterans are only disqualified from using the Veterans Choice Program if they live within 40 miles of a facility that actually offers the service that they need. And Mr. Chairman, while I won't offer these amendments today, I hope we'll continue to work together in support of our country's veterans. There is so much work for us to do. I appreciate the bipartisan spirit of this markup and look forward to supporting the bill.